Hello and welcome to Workforce Wednesday, brought to you from General Practice Solutions. I'm Jenny, and today we're talking about something that's at the heart of every successful primary care team, building a workforce that's skilled, resilient, and ready for the future. We're drawing inspiration from discussions in primary care, but this episode is all about practical strategies you can use in your practice or network and, of course, how General Practice Solutions can support you along the way. The challenge is clear. Primary care is under increasing pressure. Patient demand is rising, populations are aging, and more people are living with complex long-term conditions. Traditional staffing models, mostly GPS and nurses, simply can't meet this demand on their own. The solution lies in innovation, flexibility, and thoughtful workforce design. Across the UK, practices are exploring new ways of working, introducing new roles, and reimagining how teams operate to better serve patients and support staff. Take clinical pharmacists, for example. Practices are now integrating pharmacists to manage medication reviews and chronic disease care. This frees up GP time for complex consultations, while also offering pharmacists a clear career pathway within primary care. Paramedics are another example. Once mainly in urgent care, they're now stepping into GP practices to handle same-day appointments, minor injuries, and home visits. This helps patients access care quickly while allowing GPS to focus on complex cases. And then there are physician associates, who take on routine appointments, support long-term condition management, and contribute to mentoring and education within the practice. All of these changes require planning, training, and strategic HR support. That's where General Practice Solutions comes in. We work with practices, networks, and PCNs to help you design, recruit, and retain the right mix of roles. Whether it's advising on workforce strategy, implementing flexible models, or supporting career pathways, we help you make these innovations practical and sustainable. Transformation also depends on collaboration and supervision. New roles need structured induction, mentoring, and clear supervision to thrive. When staff feel supported, they perform better, stay longer, and contribute more to a positive culture. GPS can provide expert guidance on setting up these frameworks, ensuring that your team grows stronger with every change. Flexibility is another key ingredient. Some practices are blending roles, rotating staff between home visits and clinic work, or combining urgent care and chronic disease responsibilities. These approaches reduce burnout, increase engagement, and make teams more resilient, and GPS can advise on how to implement these models efficiently and safely. From an HR perspective, the lessons are clear. Workforce planning isn't just about filling vacancies. It's about designing roles, supporting staff development, and building resilience into your team. Effective communication is crucial, too. Everyone, from staff to patients, should understand why roles are changing and how the new structure benefits care and workflow. GPS helps practices communicate these changes clearly and ensures buy-in from all stakeholders. And the beauty of these transformations is that they don't always require huge budgets. Many of the most impactful changes come from rethinking existing resources and deploying them creatively. GPS can help you identify opportunities within your current workforce, optimize skill mix, and develop pathways that retain talent and improve patient care. Practices that get this right report better outcomes across the board, higher patient satisfaction, improved staff morale, and lower turnover. The key is strategic thinking, thoughtful support, and a willingness to innovate. GPS is here to help every step of the way, whether that's building new roles, training your team, or designing flexible career pathways. So, if you're a practice manager, HR lead, or workforce planner, here's a challenge for you this week. Take a close look at your team and ask, who could take on new responsibilities? Where could flexible working improve care and staff well-being? And how could structured support or mentoring help staff develop their skills further? Even small changes can have a big impact. And with guidance from General Practice Solutions, you don't have to navigate it alone. We help practices put these ideas into action so that teams are not just surviving, they're thriving. That's all for this week's Workforce Wednesday, brought to you by General Practice Solutions. I'm Jenny, and I hope today's episode has inspired you to think differently about workforce planning, role design, and team development. Join me next week for another story about workforce innovation in primary care. Until then, support your teams, nurture talent, and remember, with the right mix of skills, strategy, and guidance, your workforce can truly transform the care you deliver.